Hi, Patty Stalker from WestfordCAT, and I'm here with Jeff Stevens with a Zoom interview. Jeff Stevens is the health director, Westford's health director. How you doing, Jeff?
Good, Patty. How are you today?
I'm doing good. Yeah, a little stir crazy, but hanging in.
Well, that's okay. You can get rid of the stir craziness by shoveling snow in April tomorrow.
Is it going to snow again? No.
It sure looks that way.
Oh gosh, it was warmer in February than it is in April. That's only in New England for sure.
No doubt.
Okay, Jeff. So let's do our weekly update, COVID update. Let's talk numbers. What's going on in
So,
Westford?
so right now, I'll give you our most current numbers. In Middlesex County, the numbers are 7,206 cases for Middlesex. In Westford, currently we have 56 confirmed cases. In that 56, we have 36 active cases and 17 people are considered to be recovered at this point.
Now,
Now,
go ahead.
within that, we're not seeing huge increases as of yet. We're seeing numbers come in anywhere from 2 to 3 to 5 a day. Today, an example, today being the 17th, we've only had one case reported to the Maven System, which is the state reporting system. That sometimes we see maybe one or two in the morning and a couple in the afternoon, depending on how the testing is and how they're reported in. But we're not being overrun to date, and knock on wood, it stays that way, like we're seeing in other communities. We're seeing places like Lawrence and Lowell with several hundred cases in their communities, which is pretty daunting to be able to handle. I know in an upcoming episode, I would like to have our public health nurse, Gail Johnson, come on with me and kind of discuss what actually goes into running one single case. And I think it would be good for the people to know how much work goes into just those trace callbacks and to find out how many people are truly involved in one confirmed case. It's kind of fascinating. So we can maybe talk about that in the future.
I would love that. Maybe we can do that next week if Gail would be willing. I think that would be great.
Yeah, if she's got time, if she's not overrun with cases, might be something we can do. So I'll be more than happy to talk about that. Within numbers, I know you and I talked quickly about there's some new numbers the state is now reporting. Initially, the state was not reporting local data, and they left that to local communities to report local data. Now, the state is giving, because they feel there is no risk to any one particular person as far as personal information being handed out because the data set is so big, they are now reporting on each community. And if you go on to mass.gov and you go to the COVID-19 page, you'll be able to find that data, and it shows you how many cases the Maven system has had reported into it. And you'll see that Westford is obviously near the end, starting with a W, has 50 cases reported. And the reporting data set is reported in per 100,000 residents. And our number for per 100,000 residents is 216 people per 100,000. And that kind of makes sense with us having 50 cases with 24,000 residents. So that kind of adds up. And the difference between our 56 and the 50 that we have in Maven is within those two numbers, there are oftentimes transfers of residents. You could have an elderly parent that moves in with a son or daughter, or you could have people that move in from an assisted living community into another community because there's a potential problem with that community. So there are times where you'll see people change in and out of communities for necessity, and we all have to live somewhere. So whatever it takes for some people, we just need to make sure we're tracking those people properly.
So I got you. So they may officially, their address is in another town, but they are in Westford with COVID.
Yes.
Okay, I got you. So a couple of things. I did see there's some communities that have 800, 900, 1,000 cases per 100,000. So Westford comparatively is doing pretty good.
Comparatively, currently, we're doing very well.
Yeah.
And I think I attribute a lot of that to we've got a great community of people that are listening to the warnings. And I think you can see that in a lot of the stores where you see a great amount of people wearing masks now. I think it's much higher than it was even a month ago. So I applaud and thank all of our residents for really working hard and taking that personal responsibility to make sure you're donning some sort of face covering.
So let's talk about that. The Board of Health meeting the other night, you gave an advisory about face coverings. Let's talk about that. I also want you to describe the Maven system after, because I'm interested in that as well.
Sure. So the Board of Health on Tuesday night talked about face coverings, and they issued an advisory recommending that everybody wear a face covering when they go out in public. So a lot of people want to know what that really means. What it means is when you go out into public, make sure that you are wearing a mask or face covering when you're going into grocery stores, pharmacies, public buildings, essential businesses, and public places where you're not able to maintain a socially appropriate distance of a recommended 6 feet or more. So there are times where people can't meet that social distance requirement. I know when I go to the grocery store, everybody's trying, but that's really tough to do on occasion. So that face mask really, really is important to have on, or that face covering. And I'll reiterate, we talked about it last week, why people are wearing the face covering as opposed to a surgical mask as one of these is there are asymptomatic people out there that can shed virus and don't even know it. So by people taking personal responsibility and wearing that face covering, you are helping reduce the spread of that virus, thus keeping people healthier longer.
Right, don't be selfish. So wear the mask not to protect you from getting the virus, but to potentially protect other people if you have it and you're asymptomatic.
Exactly.
Gotcha.
100%.
Okay, so the Maven system, what is that exactly?
So the Maven system is really the state's reporting system for infectious disease. This system's been in place for several years, and it is not specific to COVID-19. The Maven system is the disease tracking system we use for every single communicable and reportable disease there is. So if there's a person that has tuberculosis in town, they are reported into that system, and your local health agent or your nurse is going to track that case and make sure that person is aware of the risks of that and controls the public exposure to whatever that communicable disease is. So that's one of the surveillance and tools we use to make sure that whatever people have that are out there that could be a communicable disease, we're tracking and making sure that the general public isn't exposed to it.
That's great. I never heard of that. So I knew that there was some sort of tracking process, but I didn't realize it was called the Maven system, and it's so specific. That's really great. Is that just a Massachusetts thing, or does every state have?
Every state has some sort of reporting system, but we
Yeah.
use that particular brand.
Mm-hmm.
And that system makes sure that you're in touch from the local standpoint through the state with an epidemiologist and a local board of health agent and or nurse to track whatever that particular case is. It's used for influenza. It's used for tuberculosis. It's used for hepatitis. It's used for measles. And all those things, if somebody gets diagnosed with, doctors and nurses report that in, and that gets put into the system, and then public health is notified so we can mitigate whatever we need to in order to make sure there's no public transmission of that particular disease.
That's great.
Basically, if you're not hearing about any particular disease or a problem in town, we're doing our job. And that's a good thing. You don't hear about a lot of these other diseases because of our surveillance and tracking and making sure that people are properly treated.
So you were going to show how to properly put on a face covering, correct?
So what I'm going to show you is there's a couple of things that I'm noticing that people are doing in the stores. And I was hoping that I was going to have a face covering that I am getting today. I don't have that one with me because I walked out of my house without it. So I still see a lot of people in the stores with a surgical style mask. And what I see a lot of is I see people with these masks on, and a lot of times they're not put on properly. There's a proper way to put them on and take them off. The one thing you don't want to be doing is touching the face of the mask. You don't want to be this material in the folds. There's more than one layer here. And this is the portion of the mask that is protecting you from splashes, from droplets, from other people breathing on you. So you don't want to be touching the front because this is where those things are going to land. Additionally, on the inside, this is where your droplets land. And if you're sick, you don't want to be touching that either. So these two surfaces, front and back, you don't really want to have your hands on. So when you're putting these masks on, you want to be using the ear loops. Keep it very simple. Put it onto your face. There are two spots where you may need to touch, the very bottom to pull it down, and then the very top to press in your nose. And there you have the mask actually on nice and tight. It makes a reasonably good seal. If you have that on right, you should be able to breathe in and out and see the mask actually flex. That's how you know it's probably on the best for you. It doesn't work well on beards. I'm aware of that, but it's still better than nothing. To get them off, you want to do something very similar. You get them off, you pull it off, and you want to then, if you're going to get rid of this, do not touch either side. If there are germs or particles, that's where they're going to be. You want to throw that mask away. And then once you do that, you want to wash your hands. If there's any chance that you did touch those sides, you don't want to then transfer any virus back onto your face or into your mouth. So making sure that you don and doff and dump the mask properly is very important. The CDC also has great guidance on their website on how to do that, which is really helpful. And if you look for instructions on masks and face coverings, you will find it right on their front page, very much out in the open. There's a couple other things about masks that I'd just like to kind of go over, the do's and don'ts. Make sure you can breathe through it. Very important. Make sure you're wearing it when you are out in public. Make sure it's covering your nose and mouth. I have seen a couple people wearing masks like this.
I saw that the other day. I saw a guy who just had it right over his mouth and his nose was exposed. Yeah.
It is not doing its job right there. And then if you have a reusable face covering, after you've used it for the day, make sure you're washing it and drying it. Hot soap and water and a good dry will do a good enough job with that. The things that you don't want to do, if you have a person under 2 years old, do not put a mask on that child's face. It's already too hard for them to breathe. And remember that if possible, do not use these. These are really meant for healthcare and first line responders. If you can go to a mask that you can make yourself or a face covering you can make yourself, that is what we'd really like to see out in the public. Save the professional gear for the professionals. They're the ones that need it, dealing with the people that are sick in the hospitals.
Great advice, Jeff. So anything else you'd like to add today?
I would say that's probably my update for the day. And as always, Patty, thanks for having me on. And I think next week I'd like to, if we can arrange it, I can't promise it, that we have Gail come on and talk to you what it takes to run through one specific case.
I would love that. I'm fascinated.
All right, Patty, thank you very much.
All right, Jeff, so we'll talk to you next week. And thanks again, Jeff Stevens, Westford's Health Director. Thanks for being on WestfordCAT.
Bye, everyone.
I'm Patty Stalker. Thanks for watching.